The road to conception for many couples is full of trials and tribulations, but our guest has created cutting-edge software that can deliver critical information in a matter of seconds. Let's welcome back Dr. John Schnorr, fertility expert and co-founder of Coastal Fertility Specialists. It's great to have you here.
Thank you. I'm excited to be here.
Congratulations on the software. What is it called?
It's called Cycle Clarity. It's software that helps us monitor the ovary while it's on medications. That a common treatment for infertility is to give a woman medications to help her make more than one egg, and the eggs grow over time, and we can monitor that growth with ultrasound. Interestingly, ultrasound is a vaginal probe ultrasound and can be a little bit uncomfortable and generally takes 10 to 15 minutes. And right now, humans manually measure each of the eggs that are growing in the ovary. And we've been able to train an artificial intelligence neural network, a computer system, to read the images in 10 seconds per ovary. So now that 10 to 15 minute ultrasound literally is down to about 20 seconds total, which of course becomes a gigantic benefit for the patient.
Incredibly. It sounds like a very tedious process, but one that is absolutely critical to finding out a woman's fertility, level of fertility. How long did it take you to develop this?
It took us about 2 years.
And what was the impetus?
Well, we've always had a conviction that we just really want to make the fertility world a better place. And we were the first center to do egg freezing in the state, the first center to do ovarian transplantation in the state, a lot of real firsts. And so in 2019, I was reading a Wall Street Journal article that showed how artificial intelligence could now identify breast cancer on a mammogram as accurately as a radiologist. And so I thought, well, what could it do in the fertility space? And I knew a kind of a painful point for patients is these long ultrasounds. And so literally we had to identify 90,000 follicles, that's where the eggs grow in the ovary, and show the computer 90,000 times where the follicle was growing. And over time, it got smarter and smarter and better able to identify that. And of course, it does it so quickly, once it identifies it, it becomes such an advantage to the patient.
Is it also more accurate? Or is it just
it's as accurate as the human,
okay,
which is good. And more importantly, it's a second pair of eyes for the human. So now the doctor can see the actual images at any time where each of the follicles were and grow them, so he or she can then validate that ultrasound when they're making decisions on patient care. We can even go back years and look at that ovarian ultrasound years later, which helps us understand the cause of infertility, maybe best treatment practices.
Yeah, and so this took you 2 years to get to this place, but also with the blessing of the FDA.
Right. So the challenge in America, I think it's right, but America feels that if software reads a medical image, it therefore is a medical device, it needs to be regulated just like a medical device. So we were regulated just as if we were a hip implant or anything else, had to do many, many studies to show the accuracy and the safety and the efficacy and the cybersecurity, and we got FDA approval for that, which was a big journey and a lot of fun.
Was it fun?
Yeah, it was fun. It had its own challenges.
I don't know that I've ever heard anyone describe
it
that
had its own
experience
challenges. I like to learn new things.
Obviously. If you are an office of many, many firsts, and you have a lot to do with that. And speaking of devices, though, this does not require additional machinery.
Right. So the magic is, number one, is 20 seconds total for the patient. Number two is we use the same ultrasound machine that already exists in the doctor's clinic. And number three is we don't add any software to the ultrasound machine. It transmits it to the Microsoft cloud where this runs, and then that's where the processing is done, and the results are given right back to the doctor's electronic medical record.
Now, am I correct in that there's also a blood test that is taken along with this? Is that still required?
Right. So it's a good question. Part of monitoring is ultrasound, part of monitoring is hormone response. So your doctor then would evaluate the ultrasound response. Part of that will be Cycle Clarity's results, but also the blood work to make decisions that day. So importantly, AI is not making any decisions for the doctor. It's providing additional information to the doctor so they can make better decisions.
How quickly is this going to spread to other offices?
Well, we're already now in 30 other offices across the United States, and we actually think this is an international effort, that this can be used internationally as well.
Absolutely. And just to talk about fertility just in general right now. So you said that you see a lot of patients every year. About how many?
Right. So we see probably at Coastal Fertility about 2,000 new patients every year.
And things are changing. You're seeing a changing trend.
We see changes in trends, and a lot of the trends are, unfortunately, women are choosing to conceive a little bit later in life, which has biologic challenges with it, where pregnancy rates are lower and miscarriage risks are higher, and those are new challenges. And technologies like Cycle Clarity will help to tackle those challenges, because I think we're going to be able able to learn what the optimum egg size is at different ages of a woman's life, which we don't currently know.
Right. Well, I want to thank you so much, Dr. Schnorr, for joining us and
Thank
telling
you.
us all about this and sharing cycle clarity. I know that a lot of patients are going to appreciate a less invasive, less painful process.
Much better.
Yes. We're back after this.